Hello, I'm Dr. Rebecca Erwin Wells, and I'm so honored to be here with you today. I'm the founder and director of the Comprehensive Headache Program at Atrium Health Wake Forest Baptist in Winston-Salem, North Carolina. So I'm going to share my slides and talk to you today, and then I'm excited to have some questions and answers at the end of the session. So I'm so honored to be here today presenting to you about migraine and brain health. I have no industry conflicts, and everything I will be discussing today has evidence, just some approaches do not have evidence specifically for headache medicine. So my goal today is to describe my path on describing brain health and studying brain health and migraine, to discuss strategies to improve brain health and migraine, and to share opportunities and options. So when I was a college freshman, I rowed on the crew team, and you can see me here rowing. And when our coach recommended that we take a weekly yoga class to improve our posture, I was really intrigued. At that time, yoga was not very popular. It was not in the mainstream like it is now. And in fact, at the time, yoga was not even allowed at our local YMCA because it was not Christian enough. Interestingly enough, in doing that yoga class, I noticed that my mood improved and I seemed to be able to concentrate better in classes. And I really started to wonder what's going on in my brain when I'm doing this. And I had been an athlete my entire life, running cross country and swimming and playing softball, and now here rowing in college. But somehow doing this practice of yoga seemed to be a little different. And it really actually made me start questioning what is happening in the brain. And that really began this journey. And so after college, I went to medical school and then I pursued residency at the University of Virginia. And at the end of residency, I really decided I wanted to do some research to investigate mechanisms and efficacy of what's going on in the brain when people are doing and engaging in activities that may promote brain health. And so I went to Boston and got my master's in public health to really study these interventions and did a 3-year research fellowship in integrative medicine. I then stayed in Boston and did a headache medicine fellowship so that I could learn how to really care for patients with headache. And in 2012, 10 years ago, I arrived at Wake Forest Baptist to found our comprehensive headache program. And for the last 10 years, I have been conducting NIH-funded research to really evaluate non-drug approaches for migraine. And so here I am today talking to you. This talk would not be possible without Dr. Brian Plato, and I'm so honored and appreciated he reached out to me to speak today. And Dr. Plato is the immediate past president of the Southern Headache Society, and I just have stepped into his shoes as the current president, and I have to tell you, I've learned so much in a very short period of time, and my appreciation for him has gone up even higher just in the last few weeks since taking over as president. He does so much for headache medicine, and it's an honor to be presenting today with him inviting me here today. So I just really appreciate Dr. Plato. So let's begin with the patient case. This is a patient that I saw recently who had had migraine for 30 years, and she was currently still having about 15 to 20 days a month with migraine attacks. And she had tried so many medications and failed many, many treatments. And she currently was on a medication to prevent headaches, and it had helped. Her headaches had been 28 to 30 days a month, and so it had brought them down to 15 to 20 days a month. But she was still severely impacted by her migraine. And she was interested and said to me, I'd really like to think about some natural approaches and some non-drug approaches. So over 39 million Americans have migraine. 1 billion people worldwide. It's more common than asthma or diabetes. It costs $14 billion annually. 30% of those with attacks require bed rest due to the severity. 1/3 of patients with migraine treat attacks with opioids. Many patients want to avoid medications, whether due to medication side effects, pregnancy, nursing, or other medical conditions that limit medication use. So when I think of brain health, I think of all the ways that we can water our brain to make it healthier. The World Health Organization defines brain health as the state of brain functioning across cognitive, sensory, social, emotional, behavioral, and motor domains, allowing a person to realize their full potential over the life course, irrespective of the presence or absence of disorders. I also believe that brain health is a gift that we can give ourselves. And today I will discuss active ways that you can empower yourself to water your brain. Stress is a part of life. We all have stressors in life, and we're not going to get rid of stress in our life, but we can learn how to find effective ways to manage stress. Stress is the #1 reported trigger for migraine. So targeting stress is an important part of brain health, and it's especially important for migraine. So does stress cause migraine? I often think of stress as a factor that can feed migraine. Similarly, anxiety and depression can feed migraine. Migraine can also be very stressful and can make depression and anxiety worse. They all feed each other. So I think of stress, depression, and anxiety as going in one direction, and factors that can help brain health are going in another direction. It turns out also that activities that promote brain health can also diminish stress, depression, and anxiety. In fact, I really think that targeting migraine and targeting depression and anxiety and stress takes a multimodal approach. So medications can be really helpful alongside ways of supporting brain health. And it isn't just the medication or the brain health option that helps, but one has to actively engage in behaviors to make these options effective. And so my hope is that through finding ways to target brain health, you can learn to thrive in the midst of living with migraine. So when we discuss brain health and migraine, what are we talking about? There are so many ways that brain health can be targeted to potentially improve migraine. And you can see all of the different options here in this figure. My goal for you today is to really hear about all of these options that I'm going to discuss and to choose one. One new brain health activity that's feasible and realistic for you and try it out. Once you get one down, maybe try another. It's important to recognize you don't have to do them all to start finding ways to improve your brain health. That really would be unrealistic. So as we go on this journey of discussing ways to improve brain health, I'm going to discuss lots of options. And my hope for you today is that you can see this platter of options and start focusing on one that most resonates with you today that you decide to focus on. And later you may choose another. So when we discuss brain health and migraine, I often think of the migraine brain as a brain that likes stability. The migraine brain does not like a lot of variation. And when I'm talking about variation, the migraine brain likes stability and sleep and hydration and meals. And so specifically, one thing that can be done is to stabilize the patterns of the activities of your daily life. So specifically, going to bed at the same time every day and waking up at the same time every day, even on weekends, even when you have the chance to sleep in. Having that consistency in sleep schedule is very important. Staying very well hydrated and limiting caffeine use is also really important. And then making sure that when you eat meals at the same time every day. And so that your body knows when to expect a meal and then is not waiting for nutrition. I'm excited to talk about exercise, as it is incredibly important for brain health. So Dr. John Ratey wrote a book called Spark. The image is here. And in this, he describes the revolutionary new science of exercise in the brain. I highly recommend this book. In it, he describes how exercise can stimulate neuroplasticity. So what is neuroplasticity? It's the idea that the brain can change function and structure based on what is attended to. So the cells within the brain can literally change their connections based upon the activities you choose to do. In fact, exercise stimulates something called BDNF, or brain-derived neurotrophic factor, which is really like Miracle-Gro for the brain. Exercise has specifically been shown to help depression, anxiety, and migraine. However, exercise and migraine have an interesting relationship. For some people, exercise can trigger migraine attacks. And during a severe migraine attack, it becomes nearly impossible to exercise. However, the research has shown that regular exercise can decrease the impact of migraine on life. So you may ask, what exercise is best? So we definitely need to do more research to determine the exact dose of exercise needed for the best prevention of migraine. And also, what's the best exercise? In order for exercise to have an effect, I argue that a person has to actually do the exercise. And the easiest way to have an individual do the exercise is to engage in something that you enjoy and something that you have fun doing. And if you enjoy doing it, you'll actually continue doing it and engage in it on a regular basis. And so I have this funny story where I was working really hard. I'm a working mother and a neurologist and a researcher, and our church that I go to was starting up a softball team. And I grew up playing softball. I love playing softball. And I just thought to myself, I don't have time to add in softball into my life right now. Like, it sounds really fun and everything. But somehow one of the friends on the team said, Rebecca, just come on out and join us in this game, just one game. And so I decided to play softball one night. And it was so much fun. I felt like a kid again. I just really enjoyed it. And I came home that night so excited. And I told my husband, we just need to have more fun in our lives. We do so many things because we have to do them. And it's just important to find time to do things that are fun. And so I think that's an overall strategy of doing things that are fun. But when you especially bring it into exercise and do something in exercise that you find fun and enjoyable, I think that's even more powerful. So next, let's discuss nutrition. Who has ever received a list of foods to avoid in migraine? Here's a big list, things that could trigger the migraine attack. You can see, you've probably heard of many of these: aged cheese, nitrates, bread, chocolate, alcohol, MSG, some fruits, some foods and drinks, caffeine, gluten. I bet many of you have questions about all of these, and you can see there's been so many books written about nutrition and migraine. We all have to eat, and the food choices we make can affect migraine. And so it's really important to think about, what is the role of nutrition in migraine? And so I want to take a moment and highlight something really fascinating. So I want to discuss the stages of migraine attack. So most people in the world, when they hear the word migraine, they think headache. But a migraine is not just a bad headache. And there's so many more aspects to migraine than just a bad headache. And so I want to teach you about the different stages of a migraine attack. Now, not every migraine has all these stages, and not every person experiences all these stages. But in general, we have discovered that there can be different stages of a migraine attack. There can be a prodrome, which can occur 1 to 24 hours prior to the pain beginning, and can include symptoms like fatigue and yawning and food cravings. There can be an aura. About 20 to 25% of people with migraine experience aura, most commonly visual aura with flashing lights or zigzag lines. And then usually there's a severe headache, but it's not just a headache. Usually there's also symptoms of nausea or vomiting or sensitive of light, noise, or even smell. And then afterwards, some patients maybe describe what they sometimes refer to as the migraine hangover, which we think of as the postdrome, the symptoms that occur after a headache, where people just feel miserable. And then there are also factors that affect migraine in between attacks as well. And ultimately, it's all of these time periods of a migraine attack, during the migraine and even in between the migraine, that can really affect the disability of an individual with migraine. So did you notice that when I discussed the prodrome, I mentioned that food cravings may be part of that migraine prodrome? So it turns out that it's possible, and some new research suggests that that time during that prodrome, when the migraine has already begun, and a person is experiencing potential food cravings that lead them to eat things like chocolate, bread, things like that, that actually may be part of the migraine itself. And then the migraine continues and the headache begins, and then the migraine continues. And so it may be that eating chocolate or eating breads or other foods that are sometimes crave during the prodrome may be part of the migraine itself and not the actual trigger. In other words, the migraine attack has already begun when someone eats that chocolate. And so it's very interesting. I think definitely more research needs to be done in this area to fully understand this, but I think it's an important point to recognize. It's why this is so important is that if a person is living their lives trying to avoid lots and lots of triggers, they can end up living a life with a lot of avoidance behavior. And that avoidance behavior can really induce anxiety. Oh, I can't do that. Oh, I can't do that. I can't eat that. I can't go there. I can't see that. I can't. And that anxiety may be part of what's actually making the migraine worse. And so it can become this really vicious cycle where the goal of avoiding triggers can actually make the migraine worse through this cycle. And so when I discuss nutrition and migraine with patients with migraine, I really discuss the importance of a diet filled with lots of fruits and vegetables and avoiding processed foods. And in medical school, we really don't get a lot of training on nutrition. And so I have a colleague, Dr. Vanessa Balte-Penry, who's pictured here, who wrote this excellent book called Nutrition for the Health Professional. And really it just describes how important it is to talk about an overall healthy lifestyle and how eating foods filled with fresh fruits and vegetables are just an important part of an overall healthy nutritional diet for patients. And so that also has some great recipes in that, but it's something important to think about rather than spending your life trying to avoid certain things, filling your life with lots of fresh, healthy fruits and vegetables it may be a healthier way to approach food and nutrition and migraine. So let's talk about migraine and sleep. Insomnia or difficulty sleeping can set off a migraine attack. So if you get better sleep, then you may have a less likelihood of having a migraine attack. What's interesting and important to recognize is that during a migraine attack, a person's sleep may actually be disrupted. So just like with triggers, poor sleep may be part of the migraine prodrome or part of the migraine experience itself. What we do know, and I mentioned this earlier, is that the migraine brain likes stability. And so there's certain active steps that you can take to enhance your sleep, and we call these sleep hygiene. So let me walk through some of these. You've probably heard of many of them, but establishing a nighttime routine, like I mentioned, where you're going to bed at the same time and getting up at the same time, and you're creating a healthy sleep environment where your bed is and your bedroom is primarily used for sleeping. Turning off electronics an hour before bed, avoiding large fatty meals prior to sleeping, reducing your overall stress, and exercise can also help you sleep better, as well as limiting caffeine, especially late in the day. Another technique is mindfulness. So what is mindfulness? Dr. John Kabat-Zinn described mindfulness as the act of paying full attention to whatever is happening in our present moment with qualities of openness, non-judgment, and curiosity. So I think it's important to recognize that we can be mindful in our daily life and practice mindfulness meditation. And so when you say, well, what is mindfulness? Sometimes it's easier to think, well, what is mindfulness not? And this image is clearly a picture of what mindfulness is not. And then this is a picture of a woman doing mindfulness meditation. And I think that sometimes we get these images of these super healthy, fit people that look like they're in this beautiful space, relaxing, doing meditation. And mindfulness meditation really can be practiced by anyone of any age, of any background, in any location. So when practicing mindfulness, the idea is that after a stimulus, we typically react to something. But with mindfulness, there's this space where a choice can be made so that you actually respond to the stimulus. You choose how you're going to respond rather than just naturally reacting to what's going on around you. And what's interesting is that mindfulness is not just relaxation. In fact, research has been done that shows all the areas of the brain that are important for meditation. And you can see them here. So I was really interested in understanding this better and conducted a clinical trial looking at mindfulness and migraine. It was a small pilot study, but we found some really interesting results. And in fact, our results were picked up by Time magazine. And so the beginning of this article said, can you namaste your migraines away? Which is a really interesting question. I want to talk a little bit more about that. So one of the areas that I think mindfulness may target are two of the areas are pain catastrophizing and self-efficacy. And so pain catastrophizing is the thought of magnification of pain-related thoughts. So it's the idea that, you have a thought, like for example, a college student is studying for an exam. And they're studying for that exam, and then all of a sudden they start to feel a migraine coming on. And they think, oh no, here comes this migraine. If I don't study for this exam, I might flunk the exam. If I flunk the exam, I might flunk the class. If I flunk the class, I might flunk out of college. If I flunk out of college, I might go home and talk to my parents, and they get so upset and frustrated and start yelling and angry at each other that they may get divorced. And so you can see that the thought of the migraine beginning leads to the thought that the parents are going to get divorced. Another concept that's really important is self-efficacy, or the sense of control over behavior, the sense that you have power over what happens in your life. And I think this is really important. So we recently conducted a clinical trial that showed that mindfulness meditation may help migraine, specifically by increasing self-efficacy and quality of life, while decreasing headache-related disability, pain catastrophizing, and depression. Yoga may also be helpful for migraine. So here are two keynote studies that were conducted in India that demonstrated that yoga resulted in clinical reductions in headache frequency, intensity, and disability for patients with migraine. So another area that's really fascinating is nature. Being out in nature can be very therapeutic. And this is some interesting research written by a collaborator, Dr. David Victorson, looking at how important and powerful nature is. Now, as far as I know, I don't know of any clinical trials that have been done specifically in migraine of how nature may help migraine, but you can just imagine how being out in nature, can really stimulate so many factors within the body that are soothing and that can be relaxing. And often we can incorporate exercise out in nature or spending time with friends and family and social interactions out in nature. And so being in nature, I think, is a really important part of overall brain health. What's also possibly helpful is expressive writing. So Dr. Pennebaker, I recently had a chance to hear him speak about the power of expressive writing and helping individuals with different experiences in their life. And so the idea is that you write for 20 minutes a day for up to 4 days in a row. And you really choose whatever you want to talk about, but it has to be something that's extremely personal and important to you. And you really write down your deepest emotions and thoughts, writing continuously, not worrying about punctuation or spelling or grammar or anything. And you just keep that pen to paper. You just don't stop. And you really just write for yourself, not to show anyone else or for anyone else to read or anything. This is not a letter. And this is for your experience only. And what's interesting is this experience of expressive writing can have profound effects on your overall emotional health and well-being, and likely could be very helpful for migraine. Although again, we don't have any specific concrete studies explicitly of expressive writing in migraine, but it could be really helpful. And you can just imagine, talking about all of the experiences that you go through in migraine. One of the questions that was asked of Dr. Pennebaker is, can you do it, on paper? Can it be on the computer? Like, does it matter if you're typing it or you're writing it? And it turns out that the research does show that it's the process of putting your thoughts to words. So it really doesn't matter if it's written or if it is typed up, but it's this process of taking your experiences and putting them to words. That's really the most powerful aspect of this. So information is power. And patient advocacy and social connection is so important in migraine. And here are a list of a multitude of organizations that have lots of opportunities for patients to get involved and get connected. And in fact, here's a multitude of books written, some written by patients about experiencing and living with migraine. And I think one of the aspects that we've discovered about migraine is it can be incredibly isolating. When individuals are experiencing an attack, they usually have to go to a quiet, dark room by themselves, and this can be extraordinarily isolating. And so learning more information and connecting with other people with migraine can be really important for your overall brain health. So we conducted a study looking at the impact of migraine through patient voices. And I was really excited. We won an award through the American Headache Society for this really important research. And we were interviewed. This is my team with students I have multiple students on my research team, and you can actually check out this YouTube link if you want to watch our interview. Oh, look, I've got the same backdrop. Looks like I'm wearing a different outfit that day than I am today. Oh, my hair was a little longer then too, but you can see this was an interview. And what we found was really interesting was that in patients with migraine, and this was from over about 89 interviews, even those that were on medications, migraine still negatively impacted their life. And what was interesting was it was beyond what we normally think about as factors affecting emotional health, like depression, anxiety, to factors like isolation, like I mentioned, anger, frustration, guilt, overwhelming guilt, anxiety, having fear of migraine, and significant stigma. In addition, what was interesting is that participants described how migraine not only impacted their lives during the attacks, but also in between attacks, and affected their work and career and relationships, not just in their home life, but in their social life and work colleagues. And so I think this is just really important to recognize that migraine has a profound impact on many areas of a person's life. And what I want to point out is that activities that promote brain health may also directly affect migraine. And activities that promote brain health may also target all these other areas that are also affected by migraine. And so all of these time points that I described as stages of the migraine attack can contribute to disability. And working on factors that target overall brain health may ultimately decrease the disability associated with migraine. And what's interesting is that different phases of the migraine attack may be great times to focus on brain health. Like, for example, during the prodrome, this could be a time of relaxation or deep breathing or hydrating or taking a rest or sleeping. In between attacks may be a great time to focus on brain health. So thinking about the time periods during or in between a migraine attack and when you can focus on brain health is important. So we're doing research in this area, and you can help us better understand these factors so we can have a better sense of how brain health factors can really affect migraine. And so we're conducting several studies of non-drug treatments in migraine. And if you're interested, email us. This is our email, help4 with the number 4 migraines @wakehealth.edu. So in summary, there are so many options of ways that we can target brain health and migraine. And we talked about them today, doing factors in your daily life to keep your daily life and daily activities stable. Exercise, nutrition, sleep, mindfulness, yoga, nature, expressive writing, and patient advocacy. So in summary, targeting brain health is really important. And there's so many options. And start with one and do something that you'll enjoy. If you enjoy doing it and you make it a focus, then it's something that you will continue to do. And that's very important. And empower yourself with information. It's just really important. So I'm just so appreciative of all the research support that I have received in order to conduct research in this area. And clinical research is a team effort, and I'm really indebted to all of the mentors, collaborators, and students who have made our research possible. And so now I'm excited to be able to answer some questions and have a discussion. Thank you so much for your time today, and I'm looking forward to answering your questions and talking about this really important topic.